Go ahead.
Okay. Okay, in the name of God. Acromegaly. Sahar.
Hello, Sahar. Sahar is controlling your screen, huh?
Okay. Okay, introduction. Acromegaly is a disorder that results from excess growth hormone after the growth plate have closed. What is acro? Acro is extremities and megaly means enlargement. Acromegaly is a rare disease of the pituitary gland in the brain caused by benign tumor. Okay, what is pituitary gland? Pituitary gland is a pea-sized gland that releases and regulates several hormones, including human growth hormone, and that is responsible for regulating growth. Okay, hormone produced by pituitary gland. Pituitary gland is include two parts: anterior pituitary, posterior pituitary. Anterior pituitary is include adrenocorticotropic hormone, thyroid stimulating hormone, luteinizing hormone, follicle stimulating hormone, prolactin, growth hormone, melanocyte stimulating hormone. And posterior pituitary is include antidiuretic hormone and oxytocin. And in this picture, you can see anatomy of pituitary gland: anterior pituitary, posterior pituitary, and those I told is in this pic. And optic chiasm and hypothalamus also is up the pituitary gland. Okay, causes. It is uncommon to find pituitary tumor. 1 out of 10 people have tiny tumor in the pituitary gland, pituitary adenoma, but only 3.5 per million people develop acromegaly. About 98% of cases of acromegaly are due to overproduction of growth hormone by benign tumor of the pituitary gland called an adenoma. Other tumor of pancreas, lung, and adrenal gland. Acromegaly with gigantism. If hyper secretion of human growth hormone occur before two epiphyseal plate close at puberty, it is called gigantism. Gigantism causes a growth in height. See, gigantism growth in height. Look at the peak height of this person. Acromegaly causes one's features and extremities to grow larger and wider. Okay, what is symptom? Symptoms include change in voice, change in face features, such jaw, nose, and forehead. Caused enlarged facial feature, cause oily, thickened skin, excessive sweating and body odor, a small outgrowth of skin tissue, excessive facial hair in women, enlarged tongue, hand and feet, weight gain, joint pain, and muscle weakness. This also is symptom. A dependent husky voice due to enlarged vocal cord and tissue and sinuses, severe snoring due to obstruction of the upper airway, impaired vision, pain and limited joint mobility, menstrual cycle irregulation in women, erectile dysfunction in men, headache, enlarged liver, heart, kidney, spleen, and other organs. Increase chest size, barrel chest. Chest size will increase. Okay, look at this picture. Changing in face features such as a jaw compared to jaw together. Nose, this nose is more big than, and forehead. And excessive facial hair in women. This is also is acromegaly. It become like men. Okay, enlarged tongue, hand and feet. You can compare two hand and feet together. Different. That big one is acromegaly. Change in face features. Look at the picture. In 1977 what was, and after that it become like this. Okay, complication. Diabetes mellitus due to excess insulin-like growth factor, kidney failure, enlarged heart. This is complication, normal heart. Another complication continue. Hypertension, heart failure, sleep apnea. What is sleep apnea? A condition in which breathing
ಕಾಳ್ದು
ಗ್ಯಾಸ್ಟ್ರಿಕ್ ಅಲ್ವಾ ಅದು?
ಇಲ್ಲ
ಏನಿಲ್ಲ, ಇಲ್ಲ ಅಂತ
peria.
ಇಷ್ಟೇ ಅಷ್ಟು ಹಾಕ್ತಿರ್ತೀನಿ.
Peria you can.
Sorry,
Okay.
it was unmuted.
Sleep. Yes, please. Sleep apnea, a condition in which breathing repeatedly stop and start. During sleep, it happens. And infertility, vision loss, fatigue. Diagnosis with MRI, magnetic resonance imaging, or CT scan. Blood test for elevated level of growth hormone or somatomedin. In normal subject, plasma GH suppresses to below half. But in acromegaly, growth hormone does not suppresses, and is in about 30% of patients there is a paradoxical rise, and the IGF also evaluated. Okay, treatment. We have treatment and medication. Treatment. First line of treatment is Spondyal surgery is usually first line of treatment and may result in cure of GH excess. Treatment is successful depending on the size of the tumor, 1 centimeter by 1 centimeter in the size. Has a higher cure rate, larger size tumor, lower the cure rate. And next one, surgical removal of the tumor. Medication. Medication that reduce growth hormone release such as the somatostatin analog, such as the octreotide and lanreotide. Dopamine agonists are less effective at lowering GH, but sometimes is also helpful. Radiation therapy can be used to bring growth hormone level back to normal, but it takes 5 to 10 years, take a full effect, and often affect other pituitary gland also. Okay, this is the name of this drug. Okay, treatment. Pegvisomant is a peptide GH receptor antagonist administered by daily self-injection and may be indicated in some patients whose GH and IGF concentration fail to suppress sufficiently following somatostatin analog therapy. HGH level and soft tissue enlargement are not expected to return to normal right away. Note bony tissue growth cannot be undone. Okay, prevention. Currently, there are no method to prevention acromegaly. We don't have any prevention to acromegaly. But just we can early detection and treatment acromegaly. This is the best option. They may be prevent the disease from getting worse. Thank you.
Okay, fine.
Thank you, sir.
And so, in this acromegaly is not much like tough disease in the sense we know on lot much about its pathophysiology, its what's going around, and as rightly said,